Welcome back, guys. After discussing about the SA nodal action potential, ventricular myocyte action potential, we have discussed about the cardiac cycle in two parts. Also, we have integrated the ECG with cardiac cycle along with the heart sounds. Okay. So, in the next video, we'll be discussing about the left ventricular pressure volume loops. Very important for the exam. The topic that I am going to discuss is left ventricular. Okay. Which chamber of the heart I am talking about? I am talking about the left ventricular pressure volume loop. LV pressure volume loop. So, if you are getting scared, oh my god, we are going to discuss about something like a graphical thing, like, don't worry, it's going to be very easy. Trust me, you already know this topic. So, if you have understood the cardiac cycle, okay, this will be very easy topic. That's why I told you, cardiac cycle is the most important thing. If you understand cardiac cycle, all the other topics will be easy peasy. Okay, cakewalk. Now, which chamber of the heart I am talking about? First tell me, I am talking about the left ventricle. Now, in the left ventricle, I am asking, what are we going to check? We are going to check about the volume changes and pressure changes. Now, do you know, tell me, do you know any volume changes in the left ventricle? You know, yes. In the left ventricle, how much blood we are going to keep? 120 ml of blood we are going to keep. Yes, we are going to keep 120 ml of blood. Out of this 120 ml, how much is going to be ejected into aorta? 70 ml will be ejected into aorta. How much is left over in the ventricle? 50 ml. So, end-diastolic volume is 120, stroke volume is 70 ml, end-systolic volume is 50 ml. So, yes, you know some volume changes. Okay, you know volume changes. And do you know any pressure changes in the left ventricle? In the beginning, the pressure is 4 mm Hg. The pressure will rise during isovolumetric contraction. The pressure is going to rise from 4 mm Hg to 81. Later, during rapid ejection phase, 81 to 120. From 120 to back to 80. 80 to 79. 79 to back to 4. So yes, you know some pressure changes also. Now we are going to discuss both the volume changes as well as the pressure changes in a graphical format. Okay, so that's the left ventricular pressure volume loop. Okay, left ventricular pressure volume loop. Now, how to understand this left ventricular pressure volume loop? Okay, let me make a diagram so it will be easy. So whenever you see a graph, always concentrate what is given on the x-axis and y-axis. So first look at here. On the x-axis, I am talking about the volumes. Okay, volume changes. Okay, I will discuss on the x-axis. Now on the y-axis here, I am talking about the pressure changes. So that's why this diagram is called as a pressure volume loop. Pressure volume loop. Now, first tell me, which ventricle I am talking about? I am talking about the left ventricle. Left ventricular pressures and left ventricular volumes. Point number 1. In the beginning, okay, in the beginning, how much blood is there in the left ventricle? Are you say what is the minimum amount of blood left over in the ventricle? Leftover blood, sir. Minimum blood that is present in the left ventricle. 50 ml. So let's say here it is 50 ml. This point which I am showing here, this is 50 ml. This is end systolic volume. End systolic volume. Okay. Now tell me, you have to fill the ventricle. Yes or no? Yes, you have to fill the ventricle. Till how much ml? 120 ml. That we will see. But tell me in the left ventricle, in the beginning, how much pressure is there? 50 ml blood is there, sir. Okay, 50 ml blood is there. But how much pressure is there? The minimum pressure that is maintained in the left ventricle, 4 mm Hg, you know. So here I am taking 4 mm Hg point. So now let's intersect these two lines. So this is the point. This is the starting point, sir. Okay, in the beginning, in the left ventricle, how much blood is there? End systolic volume 50 ml is there, and how much pressure is there? 4 mm Hg pressure is there. 4 mm Hg pressure. 4 mm Hg pressure is there. Okay. Now you tell me, ventricle will fill or not? Yes, ventricle will fill. Ventricle will fill. In how many ways the ventricle is going to get filled? So there are two ways by which the ventricle will be filled. That is 70% of the ventricle will be filled during rapid ventricular filling. So 70% of the ventricle will fill during rapid ventricular filling. And remaining 30% of the ventricle will fill during atrial contraction. So remaining 30% via the atrial contraction. So how much ventricle is going to get filled? The ventricle is going to get filled how much ml? 120 ml. So this is end-diastolic volume. So this area, this point is end-diastolic volume. Here this is end-systolic volume. So yes, now tell me what is this pink color line representing? So pink color line, it is volume change. The volume in the ventricle is increasing from 50 ml to 120 ml. From 50 ml, the blood is increasing up to 120 ml. So this is the volume change. So now tell me, what is this pink color line representing? Ventricular filling. Tell me, ventricular filling happens, 70% of the ventricle will fill by rapid ventricular filling, Remaining 30% of the ventricle will fill by active filling, that is atrial contraction. Okay, now fine. Now you tell me, once you have 120 ml of blood, once you have 120 ml of blood in the ventricle, what is the next? What is the function of this ventricle? It has to contract. It has to contract. Okay. So what is this phase called as? Isovolumetric contraction. You tell me, in the beginning of isovolumetric contraction, which valves are going to close? In the beginning of isovolumetric contraction, the mitral valve will close because this is the left side of the heart. So mitral valve is going to close. So at this point, listen carefully. At this point, which valve is going to close? Mitral valve. Mitral valve closes, creating which heart sound? S1 heart sound. Okay, creating S1 heart sound. Mitral valve closes. Let's say. Now you tell me, now mitral valve is closed. Now what the ventricle is doing? Ventricle is contracting. Ventricle is contracting. So that is isovolumetric contraction. So the pressure in the ventricle is going to rise from where to where? From 4 to 81 mmHg. So that's why, look here, I am going to show you a straight line like this. What is this straight line representing? The straight line is representing the pressure in the ventricle. The pressure in the ventricle is rising from 4 mmHg to, let's say, 81 mmHg. 81. So this phase which I am showing you, this is called as isovolumetric contraction. Okay, this red color line, whatever I am showing you here, this is the isovolumetric contraction. Okay, na? So now tell me, during this isovolumetric contraction, any volume change? See, there is no volume change. There is no volume change. So now I am talking about a single point. See, volume of the blood is not changing. But what is changing? The pressure is rising. Okay, here is the isovolumetric contraction. Now you tell me, once the pressure reaches 81, which valve is going to open? Which valve is going to open? Aortic valve, because the aorta pressure is, what is the pressure in the aorta? It's 80 mmHg. And what is the pressure in the left ventricle? It is now 81. So aortic valve will open. Aortic valve opens. Okay, aortic valve opens. Now you tell me, once the aortic valve is opened, your left ventricle is not satisfied with 81. Okay, your left ventricle is not satisfied with 81. So pressure is going to still rise. Now the pressure is going to rise from 81 to up to 120 mmHg. This is called as rapid ejection phase. Rapid ejection phase. See, the pressure is still rising up till where? Up till, let's say, 120 value, 120 mmHg. Okay. So yes, pressure is increasing. Pressure is increasing. And also see what is happening to the volume of the blood. The volume of the blood is decreasing. The volume of the blood is decreasing. Why? Simple logic, no? Because the amount of blood in the left ventricle is decreasing because the blood is going to aorta. Rapid ejection phase, during rapid ejection phase, 2/3 of the stroke volume will be ejected into aorta. Okay. So that's why, yes, the pressure is increasing. But what happened to the volume of the blood? The volume is decreasing. Okay, the volume is decreasing. Next, after rapid ejection phase, what will happen? The pressure from 120, it will fall back to 80. Okay, it will fall back to 80. So what is this phase which I am showing here in the blue color? What is this phase called as? This is called as a slow ejection phase. Okay, this is called as a slow ejection phase. So slow ejection phase. Now you tell me, once the pressure is going less than 80, actually the value is somewhere around 85, but for easy understanding purpose, once the pressure in the ventricle, if it is going less than 80, immediately which valve will close? Immediately which valve will close here? Once the left ventricular pressures are decreasing, immediately the aortic valve close. Okay, aortic valve is going to close now. Now once the aortic valve is closed, tell me, once the aortic valve is closed, who is going to begin? Diastole is going to begin. During diastole, tell me, during diastole, what happened to the pressure in the ventricles? The pressure in the ventricles will decrease from 79 to 70, 60, 50, 40, 30, 20, 10 to back to 4. So again, the pressure in the ventricle is going to decrease back to 4. So this is isovolumetric relaxation. After isovolumetric relaxation, have I taught you? After isovolumetric relaxation, there will be rapid ventricular filling. After rapid ventricular filling, there will be atrial contraction. Have I taught you already in the beginning? So 70% of the ventricles will fill during rapid ventricular filling. 30% of the ventricles will fill during atrial contraction. Okay, atrial contraction. So this is the left ventricular pressure changes and volume changes. So on the y-axis, I am talking about the pressure changes, how the pressure is increasing and decreasing. On the x-axis, I am talking about the volume changes, how volume is increasing and decreasing. Okay, so this is the left ventricular pressure volume loop. Now, how the questions may come up in your exam. Okay, they will directly point this area. Okay, they will ask, what is this phase representing? Isovolumetric contraction. What is this phase representing? This is isovolumetric relaxation. Here it is rapid ejection phase, slow ejection phase. Here this is ventricular filling. Starting point is end-systolic volume, ending point is end-diastolic volume or preload, you can say. Okay. Now, tell me, here I will be giving you some points. You have to answer. Here I am giving you points, let's say A. Okay, let's rather than giving A, 1, 2, 3, 4, 5. I am giving you 5 points, let's say. Out of all these 5 points, where do you think first heart sound is heard and where do you think second heart sound is heard? Tell me. First heart sound. First heart sound, you know, it's due to the closure of the mitral and tricuspid valves. So where mitral valve closes? So here, this is the place. So yes, this is the place where S1 heart sound is heard. So here S1 heart sound heard. Okay, this is the area where S1 heart sound is heard. And S2 heart sound, tell me, S2 heart sound is due to the closure of aortic valve. Closure of aortic valve causes S2 heart sound. So where aortic valve closes? So this is the place where. So here is the place where S2 heart sound is heard. If I am the examiner, this is the type of question that I will ask. Where S1 heart sound is heard, where S2 heart sound is heard, which phase is isovolumetric contraction, which phase is representing the ventricular filling. This is how you can expect an MCQ. Now you tell me, from which point to which point? What do you think? From which point to which point represents systole? Systole is from which point to which point? You know, systole is a phase between S1 and S2 heart sounds. Systole is a phase between S1 S2 heart sounds. So here is S1, here is S2. Okay, so all this area, whatever I am highlighting, this is all systole. So you know, you guys are experts. Systole includes isovolumetric contraction, rapid ejection and slow ejection phases. So the phase which I am highlighting here, see all this phase which I am highlighting here in the yellow color, that's a systole which contains IVC, isovolumetric contraction, rapid ejection, slow ejection phases present between S1 S2 heart sounds. And the phase which I am highlighting here in the light blue color, this phase is the diastole. Here is the diastole. Diastole includes three main phases. Okay, that is isovolumetric relaxation, rapid ventricular filling and atrial contraction. Okay, because protodiastole, diastasis, they are very, very small things. Okay, so with this successfully what we have completed? We have completed the left ventricular pressure volume loops. Now, how this left ventricular pressure volume loop is going to be changing in different diseases, that are the abnormalities. How this left ventricular pressure volume loop will be different in different abnormalities. Guys, first let me ask you, what is this condition? You have to tell me, just by looking at this diagram, you have to tell me what is the condition. Let's imagine this is your left ventricle. Okay, here is your left ventricle. Okay, now tell me, from the left ventricle who is coming? What is this blood vessel that is coming out of the left ventricle? This is aorta, let's say, for easy understanding purpose. Here is the aorta and here is the aortic valve. Okay, fine. And what happened to this aortic valve? Now in this condition, let's say excessive calcium is deposited here and this aortic valve got calcified. So now it's a narrow valve. So now the valve orifice is narrow. So this condition is aortic stenosis, or you can say left ventricular outflow tract obstruction. Okay, aortic stenosis. So now what happens in a patient with aortic stenosis? You tell me one thing. Normal ventricle, first normal ventricle, in order to open this aortic valve and in order to push the blood forward, into circulation, it has to generate a pressure of how much? It has to generate a pressure of 120 mmHg. You know, left ventricle during rapid ejection phase, the pressure is going to increase from 81 to 120 mmHg. Yes, it has to generate a pressure of 120 mmHg in order to push the blood. But tell me, here there is an obstruction. In order to push the blood forward into aorta, do you think 120 mmHg pressure will be enough? No, definitely not. It's not going to be sufficient in order to push the blood into the circulation. So now in this condition, left ventricle is going to generate, more pressure. Okay, so now it is going to generate pressure of 200, let's say 200 mmHg. Okay, so now it is generating more pressure. One thing. So this is the change number 1, first change. Okay, here is the change number 1, first change. Now what is the second change? Let me ask you. Tell me usually how much blood is present in the left ventricle? Okay, how much blood will be filled in the left ventricle? You know, 120 ml blood. 120 ml blood. Out of this 120 ml, in a normal person, how much blood will be ejected? 70 ml blood will be ejected, that is the stroke volume, 70 to 90 ml. But let's say in this person, as there is left ventricular outflow tract obstruction, there is obstruction, no? So do you think the 70 ml will be ejected like a normal healthy individual? Definitely not. So stroke volume is going to be decreased. So now in this condition, stroke volume will decrease. Let's say they are not able to ejecting 70 ml blood, now they are only able to eject 50 ml blood. 50 ml blood. So tell me, what happened to the leftover blood here? What happened to the leftover blood here? Normally 50 ml will be end systolic volume. Normally here how much blood will be present? End systolic volume 50 ml is leftover in a normal person. But in this person, as the blood is unable to be ejected, as the blood is unable to go into aorta properly, so more blood will be accumulated here. Now let's say how much is his end systolic volume will be? Now his end systolic volume will be, let's say 70 ml. Okay, 70 ml. So out of, now tell me, out of 120, how much is actually going? Out of this 120, 50 ml is going. So 70 ml is left over. So right, this is the second change. So what is the second change? There is increased end systolic volume. End systolic volume increased. Okay, these are the two changes. So now tell me, in a patient with aortic stenosis, what happens to left ventricular pressure volume loop? Now let's say this is the normal person. Okay, see, this is the left ventricular pressure volume loop of a normal person. Let's say here it will be like this. Let's say this is the normal left ventricular pressure volume loop. Okay, like this, left ventricular pressure volume loop. Okay, I have a normal person. Now tell me, what happens to the patient with aortic stenosis? In a patient with aortic stenosis, look carefully what is happening. This is how the left ventricular pressure volume loop will look like. This is how the loop will become. Okay, this is how the loop will become. See, the loop became tall and narrow. Can you tell me why? See, simple. First change number 1. Normal person generates a pressure of how much? Normal person generates a pressure of 120 mmHg. But in a patient with aortic stenosis, see, now they are generating more pressures. Now let's say they are generating a pressure of 200 mmHg. Okay, in order to push the blood into aorta, now the left ventricle have to generate more pressure. That's why the graph is becoming tall. Tell me students, in a normal person, what is the end-diastolic volume and end-systolic volume? See, end-systolic volume is 50 ml. And what is the end-diastolic volume? End-diastolic volume is 120 ml. Okay, 120 ml, right? So now what happened here? In a patient with aortic stenosis, look carefully, what happened to the starting point? See, this is the end-systolic volume now. Now in this patient, this is the end-systolic volume. So what happened to the end-systolic volume? Now it is 70 ml. Not 50 ml, now it is 70 ml, means end-diastolic volume increased. More blood is left over in the ventricle. The blood is unable to go out because there is a left ventricular outflow tract obstruction. So more blood is getting left over in the ventricles. So yes, whenever you see such a tall and narrow left ventricular pressure volume loop, the patient is suffering with aortic stenosis. Okay, so in different diseases, the left ventricular pressure volume loops are going to become different. Okay, so now look at this. Sir, have I already taught you, in a patient with aortic stenosis, what happened to the left ventricular pressure volume loop? The left ventricular pressure volume loop is becoming tall and narrow. Okay, tall and narrow. So that's it. But in your exam, you are not having that much time. You are not having this much time to find the right answer. So always remember, whenever you see a tall and narrow left ventricular pressure volume loop, always the patient is suffering with aortic stenosis. Exactly opposite, short. Tall one, aortic stenosis. Short one, whenever you see a short left ventricular pressure volume loop, see, when compared to normal, let's say this is normal. Okay. Now in my patient, the left ventricular pressure volume loop is becoming small. So the patient is suffering with mitral stenosis. Within 1 second, a short means mitral stenosis, tall means aortic stenosis. Okay. Now you might be thinking, sir, why, what exactly happened in the mitral stenosis? Okay, what exactly happened in the mitral stenosis? See, one thing you can appreciate here is, one change I will tell you. What is a normal end-diastolic volume? End-diastolic volume is 120 ml. Okay, na? 120 ml in a normal person. But what happened here? Let's say it is now just 100 ml. Okay, 100 ml, let's say. Now it is around 100 ml. Okay, around 100 ml. Now what happened to the end-diastolic volume? Decreased. So in this condition, preload or end-diastolic volume decreased. Simple logic, decreased. So that's why, okay, let me put it this way. Let's say mitral stenosis. What happened in a patient with mitral stenosis? In a patient with mitral stenosis, this area, okay, it is getting stenosed. Mitral valve gets stenosed. When mitral valve is getting stenosed, tell me, do you think the left ventricle can get proper filling? No, it's not able to fill properly. It's not able to fill properly. That's why end-diastolic volume decreases. End-diastolic volume decreases. Okay. So for everything there is an explanation. But when you see a tall one, aortic stenosis, short one, mitral stenosis. Okay. Next, when compared to normal, when the left ventricular pressure volume loop is shifting towards one side. Okay, it's a right side extension, especially right side extension. Look at this. So this is aortic regurgitation. Aortic regurgitation. What happened to the end-diastolic volume in this condition? Say the end-diastolic volume increased somewhere around 200. End-diastolic volume increased. Why end-diastolic volume increased? Because of aortic regurgitation. What does it mean by aortic regurgitation? Aortic regurgitation means, let's say here is the left ventricle. Okay, I am only talking about the left ventricle. Here is aorta. And what is this? Aortic valve. Now what happens in regurgitation? In regurgitation, do you think these valves are closing properly? No, the valve is not closing properly. So extra blood is coming from the aorta. The blood is again coming back from the aorta. So this extra filling is going to happen. Okay, from the atria blood is coming. As usual, from the atria blood is coming. Okay, blood will be filled. But this extra filling is happening from the regurgitant blood that is coming from the aorta. So end-diastolic volume increased. So one side extension, especially right side extension, if you see aortic regurgitation. Okay, aortic regurgitation. Next, exactly both the directions. That is not only one side extension, two side extension. If the left ventricular pressure volume loop, if it is extending to two sides, that is when compared to normal, this is normal. When compared to normal person, if the left ventricular pressure volume loop is extended to two sides, that is mitral regurgitation. Okay, mitral regurgitation. So just within 1 second, you can put the diagnosis. Tall one, aortic stenosis, short one, mitral stenosis. One side extension, aortic regurgitation, both side extension, mitral regurgitation. So this is how you can expect an MCQ. Next, one more possibility. Okay, usually in NEET PG exams, how they can give the MCQs, like in NEET PG FMG exams, the question was something like this. Same. Now, you have to answer. Let's say this is the left ventricular pressure volume loop of a normal individual, let's say. Now, they will give you this diagram and they will ask you, calculate cardiac output. They gave this diagram and they will ask you, calculate cardiac output. Now you tell me, cardiac output. So what is the formula for the cardiac output? The formula for the cardiac output is stroke volume into heart rate. Okay, stroke volume into heart rate. Now tell me how to calculate the stroke volume. You know, stroke volume is equal to, have I taught you? Stroke volume is equal to end-diastolic volume minus end-systolic volume. You know, the starting point is always end-systolic volume. The ending point is end-diastolic volume. So in the given example, what is the end-systolic volume? 60. What is the end-diastolic volume? 130. So 130 minus 60. How much? 130 minus 60. It is 70 ml. Okay, 70 ml. So write 70 ml into heart rate. You know the heart rate. Heart rate is 72. Let's say. Okay, heart rate is 72. Or they may change it in the like in MCQs. Like, you know, they may be giving 82 or 80, 90. Okay. So now tell me 70 into 72 how much? It will be somewhere around 5 liters. 5040 something will come. So 5 liters approximately. So this is how you can calculate the cardiac output. Okay. So from this graph they will ask you Okay, calculate the cardiac output. The difference between these 2 points, these 2 points is the stroke volume. Always remember, the difference between the starting and ending point is the stroke volume, end-diastolic volume minus end-systolic volume. So with this, we have completed the entire left ventricular pressure volume loops. Okay, all important points about the left ventricular pressure volume loops and its abnormalities and how the problem, how the problems will come from this topic. Hope the video is helpful. Thank you.